Okay, and then and I think there's another little check-in here from Tammy, just if you could check that chat, Chris.
Okay.
Awesome, thanks.
Mhm.
Okay, great. Well, thanks everybody. Thanks for coming on again and thanks for all you do. We're just going to give an update on just so many things happened in just a few days. So we want to be able to update you guys and let you know, flag to you where the Hans are. Next slide. And I believe that we're actually going to try to get all the Hans out on the takecarenewmexico.org website as well, so that people can see all the Hans, and so many things are changing. So wanted to start out once again with our DOH mission to ensure health equity. We want to work with partners like yourselves to promote health and well-being in New Mexico and improve outcomes for all people in New Mexico. So I think that's what we're trying to do here together. Here's the latest timeline. Thank you, Miranda, for always keeping ahead of the game here. Miranda's tracking all the different changes that have occurred. And you can see here that there's been a lot of changes, most recent being that booster dose timeframe changed from to at least 5 months for primary doses for both, Pfizer, and then followed by Moderna as well. And then also the Department of Health re-recommended halting Ban-Edi and Regen-COVID due to high proportion of Omicron. And Courtney Lovato, thanks, our pharmacy director, has been working a lot on that as well. So we'll be updating you all on that. In terms of the COVID-19 overview, there's been a lot happening right now. As you can see, we're still red everywhere is a high level of transmission in New Mexico and most of the United States. Next slide. You can see here that the daily new cases per 100,000 is now up to over 117.3 per 100,000. And just so I don't know if you guys read the latest article, but I think we had the most cases ever in the whole United States today. So that's pretty sobering for all of us, I think. Next slide. The infection rate is increasing to 1.37. Next slide. And then you can see our New Mexico specific data. You can see this slide here. Can you see just how high it's gone up? And it's just exponential growth at this point in time, the highest level we've seen since the beginning of the pandemic. Next slide. So I'll start with isolation, quarantine, and testing updates, since we were about to get these set up on Wednesday and we last met on Tuesday. So the CDC guidelines, as you know, reduced from 10 to 5 days, and last week we adopted those. This applies to the general population, including workplaces. Currently, it doesn't apply to K through 12. That's being looked at right now. And so we'll give you guys updates when that does change from 10 to 5 days. It doesn't also apply to homeless shelters, healthcare workers, correctional institutions, long-term care facilities, or immunosuppressed people. The rationale, I know a lot of people have been asking that, and I'm sure you guys have read that as well, but the data show they changed that based on data showing that the most infectious period was 2 days before and 3 days after. And just in the context of Omicron, so many things would be shut down if we didn't do a shortened quarantine and isolation. They also had data showing that most people didn't stay in for the 10 days. So I think only a third of the people did that. So it was also to see, like, if you reduced it to 5 days, more people would actually be able to comply with that. And then the critical part is that wearing a mask around other people for the full 10 days is a really critical part. And we were on these calls with CDC where they kind of explained that and explained the rationale. So I'm just summarizing it. Next slide. So as a result, we were able to update the guidance on the website. So now if you go to the NMDOH website, CV New Mexico Health, you'll see on the first page, it'll have the updated guidance, and it'll be based on, symptoms, testing positive, and being a close contact. Next slide. So you can share it with your patients and stuff like that. Here is what it looks like on CVNM Health. And so we also updated the policies for prevention and control of COVID-19. So that's a really good document. Epi team does a really good job of keeping that updated. And next slide. And so this is what it looks like. It was updated on January 10th. So I think that's a really great, I always look at it. This is like information.
This is from that document, but I just liked it as a summary.
Oh, that's awesome. Yes, this is a great document for quarantining if you have close contact, for asymptomatic contacts, and it goes through all the different types of asymptomatic close contacts and then what you do for the quarantine period. Did you want to add anything to that, Miranda, to that slide before?
No, I think the only thing is there are times when New Mexico guidance differs a little bit from the CDC. And so right now on the CDC website, it does say that schools can adopt that 5-day isolation. And, you know, for New Mexico, I think because of the test to stay program, they felt like the 10 days was best for isolation and quarantine, right? So I think still in discussion, but
still in discussion, yes. Yeah, so that may change, but we will let you guys know as soon as that, if that does change. Thanks, Miranda. This is a little chart that we made, our team made. Thank you, Liesel, because Liesel Gonzalez has been working on helping us like pull everything together in a very easy, hopefully easier to understand way. So what this does is build everything into little buckets. So what to do with your COVID-19 at-home test result. So if you get a positive test result, you stay home for 5 days, and that's for both vaccinated and unvaccinated people. And then it gives you the guidelines from the CDC, like stay home. You do not need to get an additional PCR test. I think that's something that we just kind of trying to let people know, because I think at some point in time that we said rapid home test, then get a PCR. Now it's like, if you have a positive rapid home test, you should just stay at home. Or if you have symptoms, if you have no symptoms after 5 days, you can leave your mask on, but wear a mask for 5 more days, all these kind of guidelines. And then it has the, if you have a fever guideline there as well. Just so you guys know, there's so much more demand for tests than we actually have the capability. There's actually a huge national like shortage of rapid home tests and regular PCR tests. So even though we have the staff and we kind of increased our staffing through contracts, those contractors aren't able to get tests either. So we're trying to just really encourage anybody who has symptoms, once again, both vaccinated and unvaccinated people with symptoms, that, you know, if you got an initial negative test result, you should still stay at home. If possible, get a PCR test or repeat that home test in 1 to 2 days and stay home until you know your test result. And we put a little caveat here at the bottom. If you can't get a test, assume you're positive and stay at home. And the reason why we kind of added that caveat is that there is the huge, you know, like supply chain issues with the testing. And then we have the information that Miranda shared over there on the slide before about, you know, if you have a negative test and no symptoms, you don't, you know, need a test at this time unless you've been exposed and you had a close contact. And this is where kind of the up-to-date information gets really important, because if you had a close contact with someone with COVID-19, CDC looked at the data and showed that people who were up to date on their vaccine, meaning their primary series plus their booster, had fewer cases. So in that case, you're now eligible for just wearing a mask around others for 10 days if you've had a close contact, and then test on day 5 if possible, you know, and then of course go into the other columns. And then if you're unvaccinated, not fully vaccinated, or without a booster, basically not up to date, you stay at home for 5 days and then wear a mask around others for 5 more days. And then we have test on day 5 if possible. And then if you develop symptoms, stay home and go to the have symptoms column. So I think this is like, if you have your practice and you have community health workers or someone who can explain that to your patients, I think this would be helpful so that people know what to do. And we're handing these out as well with the rapid test program that we're having, and Miranda will explain that afterwards. Next slide. And then this is the other guidance that we sent out last week. It was a Han. And basically it's a Han from the CDC. I would definitely just take the link to here and read all the information on there. This is considered just guidance, not mandates from the DOH, but just guidance for managing healthcare personnel with the COVID or contact exposures in the context of the Omicron surge. I know so many of you guys have, even in DOH, we have people who are sick with COVID, like, and then this healthcare is for healthcare settings, really dividing up between vaccination status, right? If you have COVID or been exposed, and then conventional, contingency, and crisis care settings. I think many of us are in crisis setting right now, but it allows you to actually not have work restrictions for people who have COVID or exposed if you have gotten to that level. But once again, I would definitely read the CDC guidance because they go into really great detail on each of these things so that you as a hospital or clinic system can adapt these to your settings. But we just wanted to flag that on a Han so you guys could have that to use. And then just mask wearing. A lot of people have talked to us about mask wearing, like is DOH going to give guidelines on masks or a CDC? This is what CDC has right now regarding choosing of masks. So choosing masks of 2 or more layers of washable, breathable fabric, completely covering your nose and mouth, fitting snugly against the side of the face, and then having a nose wire to prevent leaking. We are, saying that, yes, if you can't find a surgical mask, then use the 2-layered washable, breathable fabric mask. If you can get a KN95, that'll provide you more protection. And then obviously healthcare workers, N95 when appropriate. So just so we'll be sharing this information, but trying to see if people can basically remember to use their masks during their quarantine or isolation period, and also in general for protecting the public. And then this I just thought was a really good graphic on assessing your risk. Just once again, looking at all of these protection policies of how we address risk. So certain things are more higher risk. So maybe if we are in a higher risk situation, hopefully we're not going to indoor bar, but if we are, maybe we do want to wear a K95, right? KN95 mask, or church, or somewhere where you're going to come into close contact with people. And then if we're just going out, like grocery shopping or somewhere that has lower risk, then you might want to just wear your cloth mask or your surgical mask. So just kind of things to think about as we're like sharing with our patients and our general public. So thanks. And I think that's all my slides, except for, yes, just updated this one. The more layers you add, the safer you are. And just kind of thinking of it always as a Swiss cheese. I know we've showed this a lot of times, but one of our interns just made this little COVID clear so that here's the COVID trying to get through. And then the more layers you add, the more protected you are. So I don't know, add those layers and hopefully we'll be safer. So thanks. I think that's all my section. And then I'll turn it over to Miranda. Thanks, Miranda.
Great. Thank you. Okay, so vaccine updates. As Laura mentioned, a lot has been going on with vaccines. So just for the statewide update, we have seen a drop in the number of total number of vaccines given each week, which isn't a total surprise. Some of that is over the holiday, didn't completely rebound the first week after the holiday, but some signs that it might be picking back up. The updates that came through since our last meeting on Tuesday, and I hope I've got them all, but I think one of them is using the language up to date. That's what the CDC is now recommending, which means that you've gotten all the doses that you are eligible for. So if you're not yet eligible for your booster, then you're up to date with the, a primary series. If you are eligible, you're 5 months from your primary series and haven't gotten your booster yet, then you are not up to date. So you'll see that kind of creeping into a lot of the CDC language in the guidance on quarantine and isolation. Then in terms of vaccines, I think some of these had been just kind of rolled off the press right before our meeting last time. But the ACIP was meeting last Tuesday or I think on Wednesday, I can't even remember now, but for about approving boosters for children 12 to 15 years old, which they did, and CDC adopted it. Did I say boosters? Okay, I think I forgot to write boosters in here. But so children 12 to 15 years old are eligible for the Pfizer booster at 5 months. And so that includes a 4th dose for immunocompromised children 12 to 15 who are eligible for that additional dose, and then 5 months after that for a booster. For the Moderna and Pfizer booster intervals, both changed to 5 months on 2 different days, but at least now are similar. And then immune-compromised children ages 5 to 11 are now recommended to get that 3rd primary dose, is sort of what that additional dose is getting called now. And that remains 28 days from the 2nd dose, which in the case of children 5 to 11 can only be the Pfizer. And CDC actually has a nice chart here at this link. So they've updated their guidance. This, our immunization team, and thank you to Edward Wake for shepherding this project through, but basically I think it's nice, and especially in clinical settings, we had a lot of discussions about kind of one flow chart that captures sort of all the recommendations, and I think they've done a pretty good job. We do have it as a PDF and we can send it out after this meeting, but they did a really nice job, and that has been updated. This is sort of a much simpler chart for the FDA, maybe more of a patient-facing summary of recommendations right now. And then the last thing I'll just say about vaccines. So there are 4 FEMA mobile buses and vaccine teams here in the state. So they are kind of scattered around, and they may be in a neighborhood near you, but if you have questions about what's going on, it's not super well marked. It mostly looks like a Yankee bus, and then in small letters here, it does say COVID-19 mobile vaccine unit. This last week, they were at the Santa Fe Fairgrounds, the Westside Community Center in Albuquerque, the Lovington Fairgrounds, and in Las Cruces. And they'll basically shift locations every week. A couple reminders from the vaccine program. They still do need temperature logs submitted weekly. The digital data log readings should be uploaded into the NIMSIS system, and any PDFs of written or like Excel spreadsheets can be submitted to this email. And if you have any questions about temperature logs, send them to the coviddata.compliant@state.nm.us. And thank you for keeping on top of that. Some more reminders, just a reminder that the gray cap, so that's the new Pfizer formulation that doesn't require dilution, but it cannot go into the freezer. It can go into an ultra low or a refrigerator, but not a regular freezer. And then a couple notes on the expiration dates. The date printed on the Pfizer pediatric and the adolescent gray cap vaccine vials indicate the manufacture date and not the expiration date. And I have definitely been tripped up by that a couple of times. Originally, the expiration date was 6 months from the manufacture date, but it has been extended to 9 months if it's held in the ultra low. The fact sheets for both orange and gray cap vials provided by the FDA now read, regardless of storage conditions, vaccines should not be used after 9 months from the date of manufacture printed on the vial and cartons. And Joelle provided this little chart that basically has the 9-month expiration based on the manufacture date. So as always, my disclaimer, I am definitely not an expert on these details of vaccine storage and handling. And I don't know if any of them are on the call, but if anything doesn't sound right, please speak up. And also we will get the real experts to answer the questions. On sort of a good news, fun thing that happened, the vaccine QR codes are now live, and Katie provided this example for us, Bart Simpson's vaccines. So this is what it looks like if you go into that Vax View and download your COVID vaccine record. It now has a QR code that you can scan and have on your phone, and shows that you are fully vaccinated. And then as usual, just the links for help. Quick update on testing. Laura covered most of it, but just the demand for testing is increasing amid shortages everywhere of every kind of test. And that's just due to the fact that Omicron is surging across the US, kind of same time everywhere. We've got, again, pretty much every, labs are slowing down for the send out PCRs, rapid antigen tests are in high demand, rapid PCR tests are in high demand, but all of our contractors and, partners in testing are saying that it's hard to find tests. Down here at the bottom, findatestnm.org does list sites that are testing, just like the vaccine one. It doesn't list all sites, but it is a resource. The Curative website, and again, Curative even is, all their sites are filling up, but they continue to test about 30% of all the tests in New Mexico. And that is no cost to New Mexicans. They do bill insurance, but won't ask for insurance if you don't have it. And same with Vault, no cost to New Mexicans. I think we might have mentioned on this call, they have put us on a little bit of a an allocation. So if you try to order Vault later in the day and that day's allocation is done, it will ask you for a credit card, and that, that people shouldn't respond to that. The better bet is going in the next morning and trying to order early in the day. And again, making sure that on the link you're using is this little New Mexico, because it is a program unique to New Mexico. Both nationally and in New Mexico, working on programs for getting some more at-home tests for people, with the goal of at-home testing. And again, they're rapid antigen tests. They're not perfect. There's even question, maybe they're even a little less perfect with Omicron, but it is one of several risk reduction strategies to reduce the chances of COVID-19 transmission. CDC is really saying they can be used regardless of vaccination or symptom status. But I think as we've talked about with, they definitely, I would say, have a better chance of accuracy if you're using them in the setting of symptoms. But also just with the limited testing, we really do want to prioritize tests for symptomatic and exposed people. The home tests have been available for purchase at pharmacies. Obviously, there's some barriers for people, and I mean, they're just incredibly hard to get right now. But the state is trying to purchase 1 million, or has purchased 1 million tests. Again, in a state of 2 million people, that isn't going to, make it across the state. So we are targeting the highest, the most vulnerable and kind of low income zip codes across the state. So taking the top 25% to distribute them. So we haven't yet received those 1 million tests, but hoping that, they're actually supposed to start rolling in by the end of the week. A big piece of this is going to be the education that goes along with what to do with your test result. And so that's part of the flyer that Laura showed, which is on the self-test page. The other thing just to point out, and many of you know, but there is a federal program supplying home tests to FQHCs and community health centers. So I think that has slowly ramped up with more health centers eligible to order those tests. The numbers, again, are still not huge. The numbers of tests they're giving us, not huge, but you know, there are different sources. Then the Biden administration plan, we'll see. I think that, you know, optimistically would probably be at the beginning of February, but that's going to be more of a home ordering situation with Amazon delivery. So that would be awesome. And then we are actually working with the Rockefeller Foundation. They have a similar test that they want to pilot and hoping we can get that going, but maybe sort of on a similar time frame at the beginning, end of January, beginning of February. So on to the therapeutics update, and I will turn it over to Courtney.
Good morning, everyone. Thank you for allowing me to be on. So we have a number of therapeutics options available in the state with recent EUA approvals. We now have oral therapeutics. However, the Omicron variant has knocked out some of the therapeutics that we were relying on for the past several months. Regeneron and BAM-EDI, which are intravenous monoclonal antibody solutions given to patients within 10 days of symptom onset, are no longer available to patients. They are not effective against Omicron. It's about 1,000-fold reduction in efficacy. So those have been discontinued as of last Friday. Currently, the options that we have available to us are Paxlovid, which is 88% effective. It's an oral therapeutic and must be taken within 5 days of symptom onset. We have remdesivir available. It's 87% effective. The only difficulty with remdesivir is the fact that it is given over 3 days. So getting patients to return for therapy is very difficult, and it's very taxing on the institutions giving it. We also have sotrovimab, which is another monoclonal antibody. It's a very easy 30-minute infusion, 85% efficacy. And then finally, our last oral therapeutic, molnupiravir, which, if you notice, has a only 30% reduction in hospitalization and death and must be taken within 5 days of symptom onset. What I want to draw everyone's attention to is the statewide weekly supply. For our very effective options, Paxlovid, sotrovimab, we have very little available in the state. So for that reason, next slide, please. The state has instituted prescribing criteria. We're currently in phase 1D of our oral therapeutics plan. All patients in all counties are eligible to receive oral treatment. However, they do have to meet the OMAS criteria. This was adapted from the Mayo Clinic's validated tool. They have to have a score of 6 or greater for monoclonal antibody infusion, remdesivir, or Paxlovid. We do make an exception for our kiddos who may be oncology patients or immune suppressed. They only have to have an OMAS score of 3 or greater to be able to get Paxlovid. For molnupiravir, the OMAS threshold is a little bit lower, and that again is because we have more supply and we're anticipating lower volume on those prescriptions since there's only a 30% efficacy. I'm so sorry. Next slide, please.
And sorry, I think when I pulled the slides over, I'm not sure what happened there.
But nonetheless, those who are going to be prescribing oral therapeutics, just a reminder that it is EUA authorized, so you must provide the FDA fact sheets and document that in your EHR. We also request that you add the date of symptom onset and the OMAS score on the prescription, whether it's ERX, fax, or if you call it in. This is critical information for the pharmacy to ensure that patient receives their medication within the treatment window, especially the date of its symptom onset. And then as a reminder, we do have a limited pharmacy network because of the fact that there is not a lot of supply coming into the state. Please check for drug interactions. The pharmacists are working to contact the patient and get a full med list, but they're relying on patient self-reported medication. So please do a drug interaction check prior to prescribing, especially Paxlovid. Next slide, please. This is just another clearer image of the OMAS score to give you an indicator of the fields that we include: age over 65, BMI over BMI 35 kilograms or higher, diabetes, chronic kidney disease, hypertension, pregnancy. We also include a scoring adjustment for BIPOC status, Black, Indigenous, people of color, and this is due to the fact that there have been health disparities throughout the COVID pandemic in these populations. So again, you'd add up the patient's risk factors, and those with a score of 6 or greater are eligible for Paxlovid or for antibody treatment. Next slide, please. Participating pharmacies the list of pharmacies is going to change rapidly. I have included a link of the list of pharmacies on the slide, which will be available. Next slide, please. It is available on our COVID-NewMexicoHealth.org webpage under provider information, and there's also a link under patient information. It includes the current list of pharmacy locations, which will expand. We'll continue to add locations as the supply increases. It also shows their inventory status that is updated once daily, but it is an important tool that providers should utilize. We have very little stock of Paxlovid, so check this before writing a prescription to see if it is in stock or out of stock. It will help in treatment decisions, and it will also help the pharmacies, preventing them from getting inundated with prescriptions that can't be filled and ensuring that patients get appropriate information. You'll notice the purple box at the top. This is community pharmacy. They will mail prescriptions directly to any patient across the state, since we don't have enough locations to hit every county. We do have some in-store locations, and those are listed below. You can send prescriptions to either location. Just know that the only pharmacy that has the ability to mail directly to a patient's home is community in the purple box. Next slide, please. For billing, these medications are paid for by the federal government. There is one exception. Remdesivir is purchased by hospitals. So for all of the other therapeutic options, they're purchased by the federal government. There's no charge to the patient. The dispensing fees will be billed to patient insurance, or they can be covered under the uninsured claim. For remdesivir, the patient may have some sort of cost associated with their treatment, but remdesivir treatment is billable to insurance and the uninsured claim fund. So there should be very minimal cost, if any, to the patient for that therapeutic option. Thank you. I have a link up here for additional questions for COVID therapeutics. Please send them in. We have a team monitoring those and are happy to answer any questions that we can't capture today.
Great. Thank you so much, Courtney. And I think that does it for the slide. So I'll stop sharing and see if there's any questions.
Miranda, if I can just share a couple of these resources with everybody and where they can find them. So there was a question about the slides. If you go to takecarenm.org and then click on For Providers, we have this yellow bar up at the top. Click here for vaccine provider updates. Everything is now in a playlist. So to access the previous weeks, you just simply click this little playlist icon and it'll update you with all the different videos, and the PDFs are listed below. So we'll keep updating this page, and it sounds like Dr. Parajon wants us to add some Hans here, so we'll be adding Hans as necessary. So that's the first one on Take Care NM. Dr. Parajon was also talking about some of the guidance if patients test positive, or if they've been in close contact, those kind of things. This red box is what she's talking about in terms of the public facing information. So if you click on one of these areas, it will take you to the the page that has the guidance for individuals that test positive, individuals in close contact, and individuals with COVID-19 symptoms. They're all on the same page, but hopefully they're clearly distinctive in terms of what guidance is for what user case. And then lastly, what Courtney was talking about in terms of oral therapeutics and checking locations, under on the same URL, cv.nmhealth.org, under the provider info tab, the COVID-19 oral therapeutics page has the oral therapeutics plan. Directly below that has all of the locations and whether or not, I'm gonna butcher this, I apologize, Courtney, Paxlovid is in stock or Molnupiravir, the M1 is in stock or not. So those are the resources that we've been talking about. If you haven't been to cv.nmhealth.org, there's a lot of information regarding the oral therapeutics, oral treatments, all of that information can be found in the drop-down off provider information.
Awesome. Thanks for walking us through that. Okay. What's that?
I was going to say we can move to the chat if
Okay.
you'd like to do that.
Up to the top. Okay, so I think the first question was just updating Take Care NM, and it looks like that got updated. And Tammy, if that isn't your question, just unmute and let us know. Okay, and then a copy of the presentation to send it out. We can definitely do that. For the booster dose, is there a grace period within the 5 and 6 month guideline for Pfizer and Moderna? And again, it's all 5 months now as of Friday afternoon. We have patients coming in a week or two early. So this is a good question. It actually, the CDC guidance says if you give it early, like as in a mistake, you shouldn't repeat the dose for a booster. That is in contrast to the second dose in the Pfizer Moderna series. It used to say the same thing for the second dose. Now it says that if you've given it sooner than the 4-day grace period, you should repeat it. So I guess I probably, in that setting a week early, I would probably talk to the person. If it's kind of the kind of situation where it's really easy for them to come back in the right time, you might recommend that. If it's a hassle and they're there, I probably wouldn't sweat giving them the booster a week early. And then I guess my comment about the second dose changing is just that, like, you never know when it's going to change. But on the other hand, I think of all the times we sweat 1 or 2 weeks early when the guidance was 6 months and now it's 5 months. So that isn't a very good answer, but there's no official grace period, and there's no need to repeat if you give it early by mistake. So I think clinical judgment in this case. Did that answer your question? That's Barbara. Let's see. And regarding the PowerPoint, okay, thanks.
Barbara said thank you at the bottom of the chat, so I think we're good to go.
Awesome. And Tanya, I'm not sure I'm following. I might have skipped something in the chat, but your comment was about public safety. Do you want to unmute and?
Yes. So it was when they were talking about the 5-day quarantine and healthcare workers when we go into crisis standard of care. The fire department has a plan. But what about police? Are they going to fall under general guidelines if we're vaccinated and unvaccinated, or are they going to fall under healthcare guidelines?
Good question, and I do not know the answer. Is that it? Are you you're talking specifically about police?
Yes, because I know previously, back in 2020, They were told they could come to work even if they were exposed because we didn't have a vaccine, if they were going to be short. And I know a lot of unvaccinated officers, so I'm kind of looking for guidance. I did get some stuff from State OSHA today, but I haven't been able to read it yet.
Okay. Yeah, I think that's, I mean, they don't fall into any of the current, like last at the beginning of all this, that it was definitely like the recommendations were about essential workers. And now it's healthcare that's really called out specifically. So I can ask of our EPI department just if there's specific guidance. And I think in all of these things, I feel like, you know, we definitely don't want to lose sight of the fact that, you know, if it's easy to quarantine for 10 days, that is definitely, you know, the more days you quarantine, the less chance you have of passing on, the better mask you wear, the less chance you have of, you know, passing virus on. So all of these things are, you know, I think it's still reasonable to think about these questions in a risk-benefit framework. And I mean, that comes into play with fire, healthcare workers, police, because if there's really no one to do the work, then you know, sometimes just have to make decisions that don't seem as safe. But if there's enough people to staff your shift, then have the person with COVID stay home for sure. Okay, let's see. Curative is currently having problems and many people are not able to register. We just have them go to the site and see if they're allowed to register on the site. I think some of that registration problem, and I can definitely send that to the person working with Curative to be sure, but I think some of it was the slots were all filled up, and so then none of the sites drop off when they're full. So probably you're probably giving the best advice possible. Usually checking back the next day. Sometimes they've added another day to the list. Can you post the link again for the healthcare worker quarantine times? Yes, I will find that. Can you post the Take Care NM link? I think, Chris, you got that up.
Mm-hmm.
I've noticed
Correct.
vaccines not being given by DOH, not showing up on the DOH vaccine record. So for Alicia, definitely, if you could email me a little more detail about that or an example, that is often the easiest way for us to kind of trace what's going on. So we would definitely want to know about that. Not something I've heard prior to you mentioning it, at least not recently. Okay.
Did Una ask that question or pose that question?
That is Alicia Benavides.
Okay.
This is Alicia.
Oh, good.
So I seen your guys' QR code, so I was just trying it out, and even on my vaccine record, it doesn't show my third one, but I did get it. And so that's how I knew that there's missing. So I wonder how many others are missing. I got my first 2 through DOH, but my last one I got through my clinic because we do them here. So I don't know what's missing, but it's not crossing over, so it only shows my 2 and not my 3rd.
Got it. Okay. So this, I think, is a relatively common problem. NMSIS has very high matching standards. So this may not be your individual situation, but one thing we have noticed happening is, you know, people got the first 2 at one place and then the next place. And if you use a slightly different phone number or someone, you know, the new place transposes 2 letters in your name or something like that, NMSIS doesn't see you as the same person. So you basically have 2 shots under one profile and 1 shot under the other profile. And we kind of noticed it because we noticed our new first shot numbers across the state are going up a lot faster than, you know, people getting that second dose. So currently we have run kind of a diagnostic on it, and Katie Cruz, who's head of our NMSIS program, actually has staff that are working on doing that matching. So that could be what's going on for you, but for you individually, you can actually reach out to the NMSIS hotline or email and kind of send your situation, and they'll look into it and you know, actually do the match if that's the case, or find out why yours didn't come through. Occasionally there are, you know, most EHRs have an electronic upload into NMSIS, and every once in a while there will be like a day that just doesn't go through, and you know, people noticing they're missing vaccine is one way that those get fixed. So so I would encourage you to reach out to them and just kind of figure out your situation, and then that might help others as well. Does that make sense?
Yes.
Okay.
The second thing that I had is some people had to enter them themselves on the portal. So just say they got their DOH vaccines and then they came to us and they don't see them on there. They were able to log back into their portal profile and add that third vaccine on the date. I don't know if that would change anything or if you'd be able to see it or not, or.
No, when you update your vaccination history on the portal, that does not report to NMSIS because that's essentially self-reporting. There's no way to verify. All that does is confirm within the system for future scheduling and messaging. So when 6 months, if there's an additional booster or variant specific vaccine that comes out that we need to message these folks, we know that they are reporting that they've already been vaccinated first or second, but those records, those self-reporting records do not make their way to NMSIS. I should say only vaccines that are documented by a provider on the back end of the system get reported to NMSIS. No self-reporting gets submitted.
And I see Una has a kind of a follow-on question, noticing that IHS doses, I think you're saying early IHS doses and Southern New Mexico are often missing. IHS for sure, any federal partners at the beginning of this, even if they normally, like many IHS sites did report childhood vaccines to NMSIS, but because it was a federal source, they were actually told not to report to the state database, but through, I always forget the name of it, but another like basically federal. So that, you know, when that kind of got sorted out, and they still do have to report federally, but they have been good enough to also report into NMSIS. But that does mean there's sort of a beginning chunk that are missing in NMSIS. And Katie and the team are working. There is like sort of bi-directional reporting. So, and a lot of IHS sites actually got working with NMSIS during the pandemic. So there is some data makeup that still needs to happen. So very astute observation. I'm not sure about Southern New Mexico. I don't have a good explanation for that. Just a reminder that the VA never reports into NMSIS, and actually there is some work federally going on trying to make that link happen, but we're not there yet. And another piece of potentially good news, New Mexico did join the immunization gateway, which means we should be able to get into NMSIS vaccines from other states that are also in the gateway. So that will be, you know, especially our neighbors, which is, I think will be helpful clinically, even beyond COVID, Arizona, Colorado, Texas, Oklahoma. Actually, I think not all of Texas is in there, but anyway, so new things for NMSIS. And if anyone has insight on Southern New Mexico, or Una, if you have some specific examples, again, we really can trace a fair amount with a specific example, and it really does help track down where there might be you know, missing. And let's see. okay, that my wife and I have both been contacted by DOH to get our booster, even though we got our booster in November. So yes, Chris, I could maybe let you take that one.
Yeah, hi Dale. Oh, oops, hey Dale. I sent you a. She does not. I sent him a message directly. I can look up her profile. Most likely, if she was vaccinated outside of the system is still thinking she's needing either a primary or a booster. In which case, if her vaccination history is updated, those messages will cease. So if you want to shoot me, Dale, if you want to shoot me her confirmation code, I can get in there and take a look. And then we can also flag this to match what's in NMSIS appropriately.
Yeah, and just kind of on the bigger scale, definitely we have used the RTS app to message people as they become due for the booster. And then, sometimes just the reminder like, hey, you still haven't gotten your booster. The problem is, as people are pointing out, they often got the first 2 vaccines at a site that used the app, and then the third doesn't, for the booster, doesn't use the app. So you still look like you're due for a vaccine as far as the app goes, or looks like you're due for a booster. This isn't a NMSIS thing. So the messaging, NMSIS doesn't have a good messaging tool. So the best way to solve that for patients is just to have them go self-report that booster into the app, then that'll turn the messaging off.
And prepare them for the next round.
Yes, yes. That, yeah, who knows, but we do prefer, that if people don't just, opt out of the app altogether, just at this point, sort of anticipating that there will likely be another round of COVID vaccines. And that isn't from any official word, but just kind of based on the history we've had so far and the fact that Israel is doing some 4th doses for people over 60. All right. And I think I didn't get through all, for which I apologize, but let me see if I can download the app, and we'll get back to people if we missed your question. Chris, do you see any? We have like a minute.
No, so I mean, some of the things that you guys are identifying are known challenges with data. So we have tons of different data sources. We have the RTS app, which is, accounting for 55 to 60% of the vaccines. 35% are happening outside the system. And so trying to match some that got vaccinated in the system with some that are outside of the system, there's some challenges with the data. But by and large, I think just keeping our eye on the prize, 37.6% have received boosters so far. The numbers that Dr. Padajón are sharing at the beginning of this are devastating for New Mexico. So getting as many people protected as quickly as possible, that's really our goal here. So messaging them, trying to motivate them to get to a vaccine site that has vaccine, whether it's a pharmacy, whether it's a mass vax clinic, whether it's a small clinic, whatever it may be. The goal is to get as many people vaccinated as possible. So as we work through these issues, we appreciate you all being patient with us. It's a very complicated, complex data challenge. There's a lot of people that are working on it, and we'll keep improving it. And just, we have an insane amount of respect and gratitude for all the work that you guys are doing, getting shots in arms. So please keep up the great work. I think that's hopefully a decent explanation of what's going on with the data. But if you want to discuss it further, feel free to reach out to me directly, and I can get into a little bit more of the detail.
Yeah. And we have had where we've sort of, from people writing things like this, discovered like couple days worth of data from Walgreens that just never crossed over, but there's sort of no way to know that it hasn't crossed over until someone kind of is like, hey, where's my vaccine? So we really appreciate everyone's attention to detail on this. And, you know, because obviously we want people's records to be up to date and want the data to be up to date. But so we'll just close with saying thank you so much for joining. We'll see you again next week. We'll try and get back on the questions that we didn't get answered, and just really appreciate all the work that people are doing out there. And hang in, it's going to be a rough month, I think, for all of us. But we'll get through it. All right. Take care.
Bye, everybody.
Bye-bye.